Since the COVID-19 pandemic began, many health officials and leaders have encouraged people to wear face masks to help stop the spread of the virus. In the United States, masking has stirred intense debates, with schools and local governments facing demands for and against mask mandates. By September 2020, the U.S. government had provided 600 million face masks to the public. Many states and municipalities enforced mask mandates, while some leaders pushed for a nationwide mandate. For instance, New York City imposed a $1,000 fine for not wearing masks. And then presidential candidate Joe Biden stated that wearing masks is a scientific necessity, not a political choice. Over 40% of the global population has lived in places where masks were required at times during the pandemic. However, there is limited agreement on the effectiveness of wearing cloth masks to prevent respiratory infections in the United States. A review by the respected Cochrane Collaboration found no significant difference in infection rates between masked and unmasked groups in surgical settings. And another review noted that masks may not significantly affect outcomes related to flu-like illnesses. Initially, the World Health Organization, WHO, was hesitant to support widespread cloth mask use due to insufficient scientific evidence backing it. This raises questions about whether mask mandates are mere public health theater, or if new evidence supports the idea that masks help reduce virus transmission. The existing literature on the effectiveness of masks against respiratory infections, including COVID-19, is summarized here. As a researcher with over 40 years in public health, I am troubled by how intuition or biases have often replaced a true scientific approach during the COVID-19 pandemic. The backlash against a systematic review of masking evidence highlights a bigger issue of confusion and groupthink in this area. My own experience with the publication of a scientific critique of masking indicates a reluctance in media to engage with research that challenges the mainstream narrative. Until April 2020, many experts, including Dr. Anthony Fauci, acknowledged that evidence showed masks offered limited protection against respiratory viruses. However, the CDC suddenly declared masks essential, claiming them to be highly effective without new supporting data, a decision criticized for lacking scientific foundation. Observations regarding lower rates of spread in East Asian countries were used to justify this shift, but no solid data followed to back it up. Expert Michael Osterholm noted the unprecedented nature of such a recommendation made without supporting data, raising concerns about science-based policy decisions. Over time, studies that suggested any benefit from masking were celebrated, while stronger evidence indicating that masks had minimal impact on COVID-19 spread was often ignored. For example, a Danish randomized controlled trial found no significant protective effect from surgical masks. Yet this study went largely unnoticed by the CDC, which favored weaker observational studies. Some proponents dismissed the Danish data, claiming an insufficient sample size, demonstrating an inclination to reject contrary evidence. A large randomized controlled trial from Bangladesh published in 2021 revealed no statistical benefit from standard cloth masks, only minor effectiveness from surgical masks in reducing self-reported symptoms, although biases in the study raised questions about its conclusions. Nevertheless, many viewed the results as proof that masking works. A recent update by the Cochrane Collaboration found no strong evidence supporting community mask use for COVID-19 or respiratory illness prevention, which stirred controversy, as some claimed it confirmed the ineffectiveness of mask mandates. The Cochrane reviews are known for their rigorous methodology and thoroughness, helping to settle medical controversies. Despite the rigor of these reviews, some critics claimed that the Cochrane report combined studies that were too dissimilar, though such approaches are typical in meta-analyses. While no methodology is flawless, if masks were indeed effective, the Cochrane findings should have shown some benefits. The review indicated only a slight effect from hand washing. The lead investigator confirmed a lack of evidence supporting mask efficacy, emphasizing their thorough examination of the available data. The Cochrane review calls into question the widespread assumption that masks provide significant protection against COVID-19. The idea that they work well at the individual level remains unsupported by definitive data. Additionally, data from East Asian countries, often cited as evidence of successful masking, are worth reassessing. especially since Hong Kong had a high death rate despite strict masking policies, while Sweden saw normal mortality rates without stringent mask mandates. Moving forward, it's crucial for public health officials to communicate the limitations of current mask evidence honestly. If decisions are made based on these uncertainties, they should adapt as more conclusive evidence arises. Misrepresenting the data could harm public trust and detract from other effective health measures, such as vaccination. Overall, the debate surrounding mask mandates has broader social implications that extend beyond health outcomes. After 3 years of the pandemic, it is crucial to genuinely follow the science regarding COVID-19 strategies. This includes adopting evidence-based approaches to masking and improving how COVID-19 hospitalizations and deaths are classified, similar to methods used by places like Los Angeles County. Establishing national standards for these statistics would lead to a more accurate understanding of the situation. The need for a true evidence-based approach must overcome any ongoing resistance to following the science. The views expressed here represent my perspective and may not reflect those of all viewers or the publication.